Hello everyone, my name is Ethan Levin, and today I will be discussing a specific type of equine or horse-related lameness. Lameness is an all-encompassing medical term describing the inability to walk without difficulty as the result of some injury or illness affecting the leg or hoof. Lameness, then, is associated with a long list of possible injuries or disease processes affecting the limbs of these beautiful animals. In this discussion, I will specifically address a disease known as laminitis, which can cause debilitating lameness for horses. I will also discuss human links with equine laminitis and discuss actions horse owners can take to prevent or mitigate lameness their horses experience associated with this disease. I will not address other types of equine lameness because, as I mentioned before, the list and associated causes are extensive, and each is quite information dense. Working at Adobe Veterinary Center as an equine and livestock technician, I've been exposed to cases of equine laminitis and have had the opportunity to help care for patients with this condition. I did not have much knowledge about the condition before asking the doctors at the practice questions and researching the subject myself. I find what I've learned to be fascinating, and I hope you find what I share about the condition to be fascinating as well. When I asked one of the doctors at the practice about laminitis, she gave me the analogy that the laminae are like strong Velcro that hold the hoof to the bone, and when it wears out or loses its integrity, it is never the same. This is truly the best description one could give regarding this condition, and I will show you why. Amy Young, the equine outreach manager at the University of California, Davis, provides us with a more precise definition of laminitis. According to Young, as you can see in the slide here, laminitis is damage and inflammation to the tissue, the live tissue, between the hoof and the underlying coffin bone, or distal phalanx, P3. This tissue, the laminae, also called lamellae, is actually folded layers of tissue contacting the surface of the bone on one side and the inside of the hoof wall on the other, connecting the two. In order to understand laminitis better, one must first understand the general anatomy of a horse's hoof. The hoof is composed of numerous different structures, but a few of the structures we will focus on for purposes of this discussion are the hoof wall, capsule, laminae or lamellae, and the coffin, pedal, distal phalanx, or P3 bone. That's 4 names for the same structure. And to be consistent, we will use the term coffin bone, keeping in mind the 4 names for the bone are interchangeable. As you might notice in the slide images, the lamina is the pink tissue in the pictures on the left and the right. The image in the middle shows the exterior of a hoof with a model depicting the location of the bony structures within. As you can see, the coffin bone is the most distal bone of the limb that appears in the lateral view in a sort of triangular shape. The far right image could be considered the hoof capsule, which you can see detached from the rest of a limb. The hoof wall is a 3-layered structure. The outermost layer, which is constructed of cornified or dense hard tissue, is known as the stratum externum or tectorium. The middle layer is the thickest and is known as the stratum medium or tubular horn. The 2 outermost layers grow downward from the epidermis of the structure known as the coronary band, which is the structure at the front and top of the hoof where the hoof wall meets the flesh of the leg. The growth of these layers happens similar to the way fingernails and cuticle grow for humans. The innermost of the 3 layers is known as the stratum internum, or it can also be called the stratum lamellatum laminar corium complex. This is the dermis, or the live component within the hoof, which is a vitally important and sensitive structure. It is also a sort of small organ in and of itself, and the main structure involved in laminitis. This cartoon model of the hoof wall is oversimplified in my opinion, but for sake of a more simplistic understanding, I think it's effective in its purpose. Continuing with our discussion of the general anatomy of the hoof, there are 2 main tendons I would like to point out that can exacerbate laminitis. As you can see in this image, the highlighted tendons are modeled with white and blue stripes. These tendons are the main extensor digital tendon and deep digital flexor tendon. These tendons attach to the coffin bone, and because of their powerful tensile forces on the bone, on unattachment of the coffin bone to the hoof wall through any tearing or degradation of the laminae, the tendons are able to pull the coffin bone out of its anatomically appropriate position. As you can see in the image, the highlighted tendon names are modeled and with white and blue stripes as I described previously. This pulling of the coffin bone out of its normal anatomical position can cause extensive pain to the horse, and in severe cases warrant euthanasia. Additionally, I'd like to point out that the coffin bone that I'm describing in this image is the triangular portion there that says distal phalanx. And you can kind of see that as that lamina would tear apart, the tendons could almost serve as a sort of tight string or rope to pull that coffin bone out of that normal position that we talked about. When talking about laminitis, we can divide it into three different phases: the acute phase, the chronic compensated phase, and the chronic uncompensated phase. Since the suffix itis within laminitis refers to inflammation, laminitis often starts with just that, inflammation of the laminae within the hoof. In the acute phase, inflammation is present, but the coffin bone has not been displaced. In the chronic compensated phase, the coffin bone is to some degree stable, yet out of alignment. And finally, in the chronic uncompensated phase, the bone is actively displacing and the laminae tearing. This is very bad. Looking at the structures radiographically, it can be difficult to differentiate between the three phases, thus, physical symptoms of pain must be considered. Radiographically, to put it as simplistically as possible, laminitis can be diagnosed when looking at the soft tissue structures, conformation, and the angle between the hoof wall and the underlying coffin bone. In a normal, healthy hoof, the frontal slope or slant that you see on the coffin bone in a lateral view should be parallel with the hoof wall. Rotation away from parallel is indicative of laminitis. As you can see in this lateral image comparing a healthy front hoof with an unhealthy front hoof, the coffin bone in the image on the left is parallel to the hoof wall, and in the second, the tip of the coffin bone has rotated downward, and you can see how that angle changes. The horse in the image on the right is suffering from laminitis. Here are some more laminitic comparisons. The bottom line is that any deviation of the coffin bone from parallel with the hoof wall is considered laminitis. And there's always this inflammation associated with this process. Severe laminitis with complete tearing of the tissue may further be termed founder. The prognosis for severe laminitis and founder is guarded to poor. The foundered patient likely experiences a great deal of pain, in which euthanasia is arguably the most humane course of action. And when looking at these three images, or I guess 6 images, the image on the far left, comparing with the lower image, you can see that there is no real deviation from parallel in that coffin bone, whereas in the middle, you see that coffin bone, especially looking at the tip, it is significantly further away from the hoof wall at the tip than it is higher up in the hoof, where it is more parallel. And you can see with those arrows and that line of distance there that it's severe. And then also in the third image, there's some rotation, which is a little bit harder to explain, but you can still see those laminitic changes. And what I really want to draw your attention to there is those dark spots in that middle lower image, because that's tearing, that's degradation and complete separation of the laminae there. Where those yellow arrows are pointing, that in particular is really, really bad and what causes so much pain. It doesn't look like a lot when you're looking at it for the first time, but it is certainly significant. Now that we understand a little bit about laminitis, let's discuss some contributing factors to the disease. I mentioned previously that the laminae are like a sort of small organ system. This is because, like other more obvious systems of the body, such as the gastrointestinal system, they are directly affected by what a horse consumes in their regular diet. The laminae are highly vascularized structures which can be affected by what occurs in other parts of the body and by what circulates in the blood. The disease also occurs oftentimes secondary to other conditions like equine metabolic syndrome, obesity, insulin resistance, and other conditions or health issues that cause systemic inflammation. Systemic inflammation and circulatory compromise are perhaps the two most specific and well-known contributing factors to laminitis. It has been established across many species that diet is a factor in control of inflammation and circulatory quality. Now let's look at one example of how diet affects the laminae at the microscopic level. Please keep in mind that this information only comes from one study of many. What I find really fascinating about laminitis, though life-threatening, is that it is largely a preventable disease. There are a lot of factors at play with laminitis, but research has shown that there are multiple steps horse owners can take to reduce the likelihood that their companion will develop this nasty disease. Several studies have highlighted diet as the single most important risk factor to address above all. A healthy diet for a horse is the best preventative care method to date and is aimed at minimizing the amount of soluble carbohydrates or simple sugars a horse consumes. And according to an article published in the journal Clinical Techniques in Equine Practice, these carbohydrates are the starches and simple sugars found in plant material that are easily broken down by enzymes in the horse's small intestine and or rapidly fermented by microbes in the horse's large intestine. Excess intake of these starches and sugars, whether in a single meal or over time, greatly increases a horse's risk for developing laminitis. Soluble carbohydrates in simple sugars increase their risk because of their inflammatory impact on the horse. According to an article titled The Equine Hoof, Laminitis, Progenitor Stem Cells and Therapy Development, published in the journal Toxicologic Pathology, carbohydrate overload with cornstarch and wood cellulose flour or black walnut extract causes microstructural changes in the hoof which resemble those of naturally occurring laminitis. Keep in mind that it's sugars here that are being fed to this animal. Calprotectin, an inflammatory protein, is expressed by extravasated or leaked white blood cells on the epidermal side of the basement membrane in natural and induced laminitis. And finally, microstructural damage and cell loss on and around the basement membrane was comparable among the experimental models and the naturally occurring laminitis. You can see in the figure there of these stained blue nuclei that the lamellae are misshapen in that laminitic hoof, which is labeled with the letter B. Given the information regarding the inflammatory impact of soluble carbs and simple sugars, what should people feed their horses? There are many factors that should influence one's decision regarding what to feed their horse. The age, size, and lifestyle of the horse, just to name a few. All these factors and others not mentioned are going to impact an animal's nutritional demand. However, it is generally a healthy low-risk option to give feeds low in soluble carbs and simple sugars. Dietary things to avoid include free range on lush pasture grass, excess grain, sweet feeds, treats that are high in sugar, etc. Horses should be fed regular hay like Bermuda or Timothy. Alfalfa hay is also a common option, but is a little higher in calories and carbohydrates, and sugars for that matter. It is also good to feed horses digestible fibers, an example of which is beet pulp. Now, what I want you to keep in mind is that there's no hard and fast rule on what to feed your horse, but these are the recommendations. And this is even more true for overweight horses trying to lose weight, horses that are at higher risk of laminitis, things of that sort. So then the athlete or working horse is going to have a much higher nutritional demand, in which case a feed like alfalfa, which is higher in carbs, is more suitable. There is a lot to be said for an appropriate diet at preventing laminitis, but that's not all that can be done to prevent the condition. A healthy lifestyle for the animal overall is also going to be vitally important at not just the health of the horse, but the prevention of this disease. And the first thing that's going to be essential is regular hoof care or farrier appointments to ensure that the horse's hooves are properly aligned and balanced. The second is going to be a regular exercise regimen to ensure that the horse maintains a healthy weight and muscle tone. And that alone is going to strengthen the integrity of the hoof and all of its associated structures, as well as keep the horse light and agile, um, so that the weight is not too much for their feet, which actually does become an issue. And finally, the third and final preventative measure that I want to point out is routine appointments with a veterinarian to ensure that the horse is in adequate health. And that can include things like lameness exams, um, intermittent x-rays, vaccinations, etc. And these are all in best interest of the animal and providing the animal with the highest possible quality of life. I've really enjoyed learning about laminitis, and researching this topic helped me to realize the importance of the health of a horse's feet to their overall quality of life. Unlike us people who can have an overall good quality of life regardless of the health of our feet, horses' feet are everything to them and essential to their survival and thriving. And as a prospective veterinarian, I want to take the knowledge that I obtain and help educate others on how best to care for their animals. I hope you enjoyed and learned something from this discussion on equine laminitis. Thank you so much for listening.